Morning, guys. I think in every household this is a problem. Leftovers. Sometimes leftovers are kept in the fridge and then you make more food and then people forget about the leftovers and then it loses respect and you don't want to eat anymore. So, as I said, in 2023, one of my mission is to reduce waste and go green. So reduce waste and go green starts at your own home. Prevent food waste. Okay, so whatever was there from the last weekend party, it's almost another Saturday coming. I put it in here. I'm bringing the honor back. Honor means freshening up the food and add some rainbows to it. And so I'm going to throw all of this into my newfound love of air fryer. Now interestingly, when we get something new which is really handy and we instantly fall in love, like Facebook is so addictive. At one stage, people, before that it was Orkut. This is artichoke, one of my favorite, one maybe two is olive oil. I use up the olive oil once my artichoke is finished as a cooking medium, and then I will use a little bit of mixed herbs. In this country everybody call herbs. The H is silent, didn't know that before. And then you sprinkle. Okay, so I don't know where I stopped, so I'm going to quickly show you again. I sprinkle the mixed herbs, and it is herbs, not herbs in UK, and in India
it's
it
7,
is herbs. Go running. No, I'm a bit late. So this is my peri-peri masala and garlic crushed in, and I was talking about Teflon coating inside. So I'm thinking, should I remove all the Teflon-y stuff, which is this pan and change it with some non-Teflon container. And then I was showing you the coffee, and I was showing you this. So today I will go and I will buy 6 of these and make everything more organized and put name tag there. And I'm going to have this as raw, so everything will go in my lunch box. This and some of this, not all of this, and this. And this is my gym food. This is my prebiotic, probiotic. My prebiotic is the green powder. It's called AG1, Athletic Green 1. And my sorry, did I say probiotic? Yeah, this is prebiotic, which is green smoothie, and this is probiotic, which is Greek yogurt. And then comes my protein powder. It's all transferred into this because it is a bit difficult to take out from. 1 second. He's saying add food, meaning it is a little bit of churning, and on the second alarm I will stop it. So I transferred most of this whey protein into this, and yeah, and this is my mixer. So you click twice because sometimes whey protein doesn't mix very well, so I'm going to tip it up and mix again. I did a mistake of adding this in a wet, so I washed it and I didn't dry it, and now it is sticking there. I guess I have to deal with this bit. And some creatine juice, 3 every day. So I think it's done. Nice smell. So I will just take a handful of stuff. Cheese is my favorite, so let me take all of the cheese and some of the red pepper because my wife doesn't like red pepper. I think that's enough. So that's my gym food. That's my snacks, tea, coffee in the hospital, and that's my lunch. Now coming to my education corner. I read this yesterday, peripheral vascular disease, and today I'm going to read about cognitive impairment after cancer treatment. It's again 1, 2, 3, 4 pages. And 2 pages of this and 2 pages of this. And let's see what is in the post. As usual, boring stuff, the letter from bank, the bank statement. It's all green online, but I don't know why they're still sending me. And this was in the other envelope, our British Journal, the same company, the BMJ, British Medical Journal, but this is our specialty gastroenterology. And this is a very interesting book. This lady, go to TED Talk and type this name, fascinating TED Talk on gut. She suffered from allergy, skin allergy, joint problem when she was growing up, and as a result she wanted to become a doctor, and then I think microbiome expert. Let me quickly read it for you. Yes, as you saw, she was suffering from a lot of skin condition. Then she started studying medicine, and then she was reading about a case report about a man contracting skin problem after taking antibiotic for gastroenteritis. So she started treating her skin condition as a disease of the intestinal condition, like a leaky gut. So she stopped eating dairy products, cut out gluten almost entirely, swallowed various bacteria culture, and generally improved my diet. And then all her skin problem, which has been bothering her for a long time, has disappeared. Then the second thing, one day she was sitting next to a guy with the smelliest breath, and it is not like, what is it, very interesting description, scratchy hydrogen breath of stressed out middle-aged gentleman. It was not like that. Neither it was sugary fetid funk from the mouth of an elderly aunt with too sweet a tooth. It is a different kind of smell. And the next day he was dead. He had killed himself. And then a bad case of gastroenteritis her friend suffered from, and then she went into depression. So all of this made her think there's a very serious relation between skin and brain and joint and microbiome. So that is all about. Read it, fascinating read. But let me focus on my scheduled reading. Before I do that with my morning coffee, it's a very interesting pH strip. If you think you have got acid reflux, you can check the saliva acid with this. If it's strongly acidic, maybe you are having acid reflux. And today my another job is to show you how to wash the car with a little amount of water. Yes, and I need to choose which perennials I'm going to go for my garden. Which one would you choose? Maybe all three. But why there is no yellow, no blue? It's all same shade. Okay, so I have finished reading this. I think I need to do a separate YouTube because I have found this very interesting and it can help a lot of patients who are going through cancer treatment. So this is called CC, cancer-induced cognitive impairment, or ChemoBrain. And this is quite common. More than 20% patients self-reported their brain is not working as before, and mostly processing speed, they take time to understand what's going on, executive functioning, working memory, and verbal memory. So you look for words. And there are some genetic risk factors, ApoE4 gene, which is also linked with Alzheimer's. However, forget about that. That's nothing we can do about. And the mechanism, how it does what it does: decreased dopamine, okay, impaired neural plasticity regeneration, so no new neurons are forming, impaired hippocampal neurogenesis, because hippocampus makes new neurons, that's not happening. So this is new neuron, this is existing neuron, but they regenerate and they make more connection, like they become more moldable, plastic. And finally, neuroinflammatory response to oxidative stress, called ROS, a reactive oxygen species. And biomarkers, so how do you know? So you do hippocampal atrophy, functional MRI scan, volumetric MRI scan. You see reduced BDNF. I mentioned BDNF 2 days ago in my lecture, brain-derived neurotropic factor. You measure pro-inflammatory cytokine, IL-6, etc. And ApoE4 gene, I'll just completely disregard this because it's research. We can't do this. Neither we can do this. But we can do MRI scan to see what's going on. Yeah. So the only thing that you can do to diagnose this is coming here, neuroimaging. That can be structural imaging, volumetric MRI, or functional imaging, which is less easily accessible, which is it will show hypoactivation of the frontal cortex and ACC, anterior cingulate cortex, very, very important brain area. And then there is no guideline. That's the first sentence. Virtually no clinical guideline how to assist the patient with CC. CC is ChemoBrain, cognitive impairment after cancer treatment. Other way around. Chemotherapy induced cognitive impairment, ChemoBrain or chemofog, popularly known as chemofog. So this is very serious. You are just surviving from cancer only to be left with a different brain which is underperforming compared to your normal brain. And I thought it is only with chemotherapy. No, with hormone therapy, with immunotherapy, targeted therapies, all can affect your brain. So I have created now my own algorithm, like what I'm going to tell my patient, whoever I am going to give a diagnosis, breaking bad news, which we do all the time. Obviously, that is not the stage you tell them what to do. But when they're going through this, send them a get well card or something like that and tell, do this thing. This is under your control. So what are my guidelines? Okay, first is eat brain food. And if you want a more detailed YouTube, that is Gym Quick. What are the brain foods? But at least you need to take omega-3 fatty acid, very good brain food. Stay away from toxins, which is sinus, gum, and your gut health. Take probiotic, make sure you see a dentist and clear all the gum problem. And sinus, this is my regular practice, to wash my sinus with salt water. It's called Neilmed. I reuse it, but I'm supposed to replenish, but who cares? It doesn't, I will sterilize it from time to time, but I'm going into a dirty place, which is no nasal cavity. It has got germs anyway. I'm just washing it. Then O2, hyperbaric oxygen, is another thing which is still research, but I think that really helps regenerating new brain neurons, etc. Meditation, there are many studies showing that 3 months of meditation increasing the gray matter. Gray matter is the cell body of your neurons. White matter is the axons. Now movement, if you move, you increase myokines, and that will generate BDNF, because myokines will diffuse through the blood-brain barrier and make new cells from your hippocampus, okay, new neurons. What else I said? Learn motor activity like dancing, complex bilateral motor activity. Learn fine motor, take up ukulele. Memorization, like you are playing a role in a movie or drama and you are given a part. So act that part, memorize the dialogue. Music, even if you're a really bad singer, try to learn to sing. Singing is a whole brain activity. And balancing, see if you can do balancing move, like a stand on one leg, change your socks by not sitting on a tool. Yeah. And make happy connections, okay, because after cancer, this threat, the fear of death, it will make you shrink. You will feel sad, depressed. And as I say, there are many clinical scores, and my plan is now to get all this clinical assessment into a questionnaire like this. I found from a drug rep yesterday, gastrointestinal system questionnaire. In fact, I made the same kind of questionnaire because this is the question I would ask in my gut clinic, gastro clinic. So we can ask a question in every cancer patient when they're going through the chemotherapy. They should be asking, the oncology clinic should be asking this CC related question. And there are certain Addenbrooke's Cognitive Examination 3, one questionnaire, controlled oral word association, 36 quality of life questionnaire, depression anxiety questionnaire. So these are the 4 basic questionnaire they need to ask and repeat it at certain intervals to see whether your patients who survived cancer, gone through chemotherapy, gone through immunotherapy, now what can we do? Now, even if you don't do any of this, do this. That's the end game. Do this to improve your brain, get out of CC, ChemoBrain, chemofog, Okay, and when you say happy connection, make a bucket list, a wish list of what I'm going to do with rest of my life, my second life. And it is not that I'm going to die, let's tick off the box. It's about all the stuff that you always wanted to do but didn't get around to do it. Make those things happen and connect with other people who wants to do that, like go to Kilimanjaro, go to Everest Base Camp, go to see a sunset on a sea. You know what I mean. Anyway, I'm going to stop, and I've been invited to give a talk on this very interesting thing. Where is that gone? Pancreatic cancer and PART. PART is pancreatic enzyme replacement therapy. We use a lot. And also I'm interested in this bedside gut health check for Crohn's and colitis patient. So this is it. Every day I go out to the world. Yesterday I went to Newmarket British Racing School for our biannual meeting of the gut club. All the local education lead for the gastroenterologist will meet and discuss the trainee situation, how we improve the trainee experience and training, because these are the trainee who will become the future gastro consultant like us. So we are responsible for the training to provide that the quality of service is great, so that they can diagnose, they can treat, and overall make a decent, become a decent gastroenterologist, maybe superb gastroenterologist. That's it.